This is Jeremy, your friendly neighborhood pharmacist on Medication Minute with Jeremy. On this Medication Minute, we're going to talk about COVID-19. What is it? Where did it come from? And how did it progress through 2020? COVID-19 was first discovered in a food market in Wuhan, China in December of 2019. Its official name is SARS-CoV-2 and it is a coronavirus, which are viruses named for their crown shape when seen under a microscope. Coronaviruses are respiratory viruses that usually first developed in animals such as bats and birds, and then upon close contact with a human can go into being transferred to people. It is believed that COVID-19 was spread from an animal that might have been eaten by someone at the food market. Unlike other coronaviruses before, like SARS in 2002 and MERS in the Middle East in 2012, COVID-19 is rapidly spread from person to person and many times can even be spread by someone who does not even show symptoms of the disease for 2 to 14 days after being infected. This makes it one of the most dangerous coronaviruses to date. COVID-19 can be spread through respiratory droplets in the air, which can hang out for minutes to hours, from a cough or sneeze of an infected person, or through touching a surface that someone has breathed on. Someone is at risk of getting COVID-19. Once someone starts to show symptoms of COVID-19, they could have shortness of breath, a dry cough that gets worse over time, chills, fatigue, or low-grade fever that gradually gets worse. Some other uncommon symptoms that can be seen are sore throat, headache, muscle ache, loss of taste or smell, diarrhea, nausea, vomiting, pink eye, and sometimes a rash. A lot of these symptoms resemble other infections like colds and the seasonal flu, but COVID-19 is much more worse than the seasonal flu has ever been. The symptoms can many times worsen and progress to pneumonia, and a system-wide inflammatory response called a cytokine storm that can cause multiple organ failure and death. Even if someone recovers, there can be lifelong organ damage in some people. Everyone that comes into contact with someone infected is at high risk of getting the disease, especially if that person is older and has other health conditions such as diabetes, heart disease, kidney disease, a weakened immune system, or is pregnant. COVID-19 can be diagnosed by blood, saliva, or tissue sample. Most of the tests we use right now are using saliva though. The best ways to prevent COVID-19 are washing our hands frequently, avoiding touching the face and eyes, mouth or nose, staying at least 6 feet away from others, and avoiding large crowds. Cleaning frequently touched surfaces regularly with disinfectant and wearing a face mask. Since COVID-19 is spread primarily through people that show no symptoms, it has spread rather stealthily and has been very much underestimated. By June, the United States had 2 million cases and over 100,000 deaths. By August, we started to see new strains and the first reinfection from someone that had been infected before. At this time, the virus was named the third leading cause of death in the United States, right behind heart disease and cancer. By November, we saw numbers spike upwards of 100,000 new cases a day, and those numbers were steadily increasing as we approached the holiday season and people started to travel more. What we need to do now is continue to focus on keeping one another safe until we have a vaccine that is readily available to the public. There are some promising vaccines that should be available to everyone soon, and I will talk more about those in a future episode. This has been Medication Minute with Jeremy. If you like this video or found it informative, please click the like button at the bottom and subscribe so you don't miss any future content. Until next time, be safe and be healthy.